So we're talking about, the governor's announcement this morning. Next week, the age eligibility will be lowered again. And then by April 5th, everyone will have access to a vaccine. Just off of hearing that, what is your initial reaction to that news?
Look, I think that if we can give access to this vaccine to more people, I think it's going to be a way for us to get this pandemic behind us. But, we have to balance the problem of access to the vaccine and the ability of people to get onto these portals and get the appointments. So I know we still have a lot of our seniors. They're very frustrated. They haven't been able to get appointments. And I'm hearing that on a continuing basis. And I'm hearing also from people who are 40 and 50 and saying, listen, we need to get the vaccine so we can get to work and be able to feel comfortable in that setting. So you're balancing the equities here.
In the last, now next week will be 3 weeks that we have the age eligibility lowered every 10 years for 3 weeks now, since they started with 60 and going down that way. Do you feel like it just hasn't been enough time for those age groups to really get in there and make appointments?
I think that the federal government is making a concerted effort to get more and more vaccine to us. We've been working with the director of Moskowitz, and we are getting additional supply of those vaccines. And I'm looking forward to the point in time when the commercial entities, Publix, Walgreens, Walmart, are taking over the responsibility from us, and they're able to push this vaccine out the same way that they've been able to do with the flu vaccine each season. So I think that we're going to get to a point where this is going to be so widely available that everybody's going to be able to get it. The people who want it will be able to get vaccinated.
And I'm glad you mentioned that, because we have heard Dr. Alonso mention over and over again that the idea is for the county health department and the healthcare district to kind of step back and just, get out of the vaccination business, right, and leave it to the pharmacies. Do you think that we're closer to getting to that point now, or further away now that, this is going to open up to everybody? And we have seen that we've been waiting to get more vaccine available every week.
I think every time we open it up to a new group, obviously there's a new rush. So I'm expecting on Monday, it's going to be very difficult for people to get appointments, but then it's going to start to recede. But I think the ultimate objective here is, again, for the commercial entities to take over the responsibility for vaccinating people. We're going to get us over the hump. The healthcare district and Department of Health and FEMA are all working to quickly get a lot of vaccine out at once. But then there's going to be a more orderly distribution of vaccine, and people are going to be able to get into it and really make an appointment today and go in tomorrow.
You mentioned that more additional vaccine is coming to us from the federal government. Do you know how much vaccine, or because I know lately we've been getting from the state, but what is the information you have?
I don't have the numbers. I'm just being told that number keeps on increasing with each additional week. We get additional supplies. And I know the Biden administration has certainly made this a priority. So we're looking for the J&J vaccine to be coming. We haven't gotten a lot of that yet. The Moderna and Pfizer are really the predominant vaccines that we're using right now.
Do you also hope that, in some capacity, the county will get to continue these, mobile efforts? Because I know that has been a huge conversation about the underserved communities and maybe not being able to get to a pharmacy or get to a location.
Absolutely. I mean, one of the things I said at our meeting was we're doing a great job with the 80% that are able to get on the computer and get in their car and get to a vaccine distribution point. The problem is there are people who are shut-ins. There are people who don't have access to a computer. So we as a county and the healthcare district and Department of Health are focusing on those people and making sure they have equal access.
Anything else you'd like to add, Vice Mayor?
No, I think that we are really turning the corner on this. I can feel it when I'm out among people. They're coming out. They're feeling a little more comfortable being out and about. We have the boat show this weekend, and I'm sure people are going to be excited about being out there and enjoying the fresh air. So I think people still need to be careful. People still need to use face coverings if they can't be 6 feet apart. And we need to just take another little bit of time to get ourselves back to a point where everybody can get back to our normal again.